Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Hey guys, thanks for being listeners to the show. Go to dentalimplantpractices.com and find all of our resources. Also find us on Facebook, Dental Implant Practices page on Facebook, and go to iTunes and leave me a review on iTunes so we can help spread the message. Thanks.
Welcome to another episode of the AAID podcast. That's the one and only American Academy of Implant Dentistry's podcast. My name is Justin Moody. I'm going to be one of the co-hosts. I'm coming to you today live from downtown Rapid City, South Dakota, Studio 1A, and I am joined by my good buddy and gifted surgeon, Dr. Danny Domingue out of Lafayette, Louisiana. How are you today, buddy?
What's up, man? How's it going? So I asked this guy to come on to our podcast because he actually interviewed me on one of his podcasts, and we'll talk about that in a second. He comes from Leawood, Kansas, and if you go to Leawood, it's Leawood, GordonDental.com. You can read more about him. You
can see his crazy cool new office.
Dude, really nice office, incredible office.
Sure, for sure.
So, Philip, thanks for joining us from Kansas City. You just got back from vacation in Destin, Florida. So I appreciate you taking the time to talk to us. Tell us about your journey and tell us about the AAID, how that's involved. I know you're part of the Academy and, you're doing a lot of things right now. You got your own Facebook group and you got your own podcast, and tell us about how that's influenced your career with the AAID.
Well, guys, thanks for having me on the show. I'm definitely big fans of yours and what you guys are doing. So it's a pleasure for me to be on your podcast. Yeah, I started implant dentistry roughly 6 or 7 years ago. So a year or two after I got out of dental school, I got my hands on some dental implants and thought, I really need to get into this thing. I didn't really have that intent when I graduated, and I wasn't really aware of any advanced programs dedicated strictly to implants. And so as I grew in my career, I realized that I really liked the surgical parts. I really liked the restorative parts, and started looking into implant dentistry in my career. That kind of just kept going further and further with desire to learn more and do more. And so really looked out to different organizations, and the AAID being one of the biggest and the best that around. I thought, I need to get going with something with them. And so I joined the AAID and have met a lot of great people. Let's see here. Yeah, started a podcast, Dental Implant Practices. So I started my own podcast, basically two reasons. I wanted to kind of be selfish and talk to some of the smartest minds out there, like you two, Danny and Justin. Yeah, I've interviewed both of you, and those are some of my more popular podcasts. So, definitely wanted to steal information from people out there that are, already doing it, already have successful implant practices and know what they're doing. And two, I thought, I wanted to share it for the younger guys, kind of like myself, who are looking for quality information and really need a good resource to go to. So I think the AAID and people like yourselves are doing a good job of that.
You've already had 51 podcasts. You've interviewed people like Payman, Brett Royal, Howard Gluckman, which is huge. I mean, did you interview Howard Gluckman? Partial extraction therapy?
I did. Yep. And
that's incredible. He's such an incredible guy. If you guys haven't listened to that podcast, it's podcast number 46. It's incredible. And, guys like Sam Lee. I mean, Sam Lee's awesome. John Minichetti, who's the Las Vegas Maxi Course director. So, yeah, incredible podcast. Tischler with T Tomorrow. Can't say enough about that podcast. You guys should definitely download and listen to some of his podcast. So great stuff. How'd you get Howard Gluckman on?
The podcast really isn't about me and my experiences. Obviously, I try to share a little bit of that because we're all kind of going through similar journeys, maybe at different points, right? Everyone kind of steps into this implantology bit, and there's a lot to learn, and everybody goes through various stages of where they're at with that. My goal for the podcast was to interview people who are, an expert in various things and have them be the star of the show. And I'm just basically a facilitator of information, asking questions that I'm curious about and that I think, maybe other people are curious about. So I basically just track people down. I'm looking for who's kind of doing something interesting, who's got a lot of good information to share, who I think is, kind of stand up people that'd be willing to share, that aren't really as self-centric. They're not always selling something. They're a lot of them are educators, a lot of them are researchers, a lot of them are also practitioners. So I think, I'm trying to find a good balance. And then obviously some of it's the business side of dentistry, because there is, we got to put pen to paper and pay our bills and make this thing work from the business side too. So most of it's, educational from the clinical standpoint, but I do like to touch on the business side of it. I try to get a hold of different implant companies, different products, different ways to run your business or sell cases. I haven't done much marketing yet, podcast, but it's all sides of implant dentistry. And Howie Gluckman, he's a great guy. I haven't actually met him. He lives, in South Africa, but with the internet now and Skype, you can reach out to a lot of these guys, talk with them. And, the hard part can be scheduling sometimes. Everyone's so busy, different time zones. And, with him, it's his nights are days. So it was, a little different scheduling, but he's doing some fantastic things.
Yeah, he's doing some incredible things. I'll say that for sure. So you're scheduled to do the next Maxi course, right? This coming fall. And where are you taking it?
I am. Yeah, I'm taking the Maxi course with Dr. Minichetti, and I did a podcast with him. I'm taking it in Las Vegas. I'd heard a lot of good things about him and his course, and so I just called up his office and talked to one of his assistants and said, "Hey, I'd like to interview and then probably join the Maxi course." And he jumped on the next week, and so we did that. That went great. Starting the Maxi course, I've placed a lot of implants. I feel like I have a lot of experience, but I also have taken some continuum type courses. I want to continue to take further courses. But I'm also going towards credentialing. And so that's obviously a big part of that. I will need to get the 300 hours through the institute-driven CE that the AAID offers, and, go for the associate fellowship, and then, hopefully one day, diplomate like you two guys. And, I've got a 5-year goal for the diplomate status, and hopefully, that's something I'm driving to, and the Maxi course just seemed like the next logical step. So everybody I've talked to said it's a great opportunity, and Las Vegas just happened to be a one-way ticket for me on Southwest, so I thought I'd take it there.
Yeah, John's a great dude. You got to learn a ton from that course, and having taken a Maxi course myself, I had taken some other continuum type courses, and I just think that. You can't take too much, like there's just, whether I tell people all the time, sometimes I, lecture and talk to people and try to help them along their pathway as well. But I think everyone's education is a culmination of everyone that you've learned from. And if you learn from one source, then you haven't really done yourself or your patients, the very best that you can. So when you go out and seek the best and learn from everyone, even if the course is 90% repetitive, and you think like, should I take another continuum? The fact is that out of the 10%, even if it was only 5%, that can make a huge difference in your practice. And it makes the whole thing worthwhile. So I commend you for going out and doing that. It's awesome.
Yeah, it's one of those things that takes so much time. I've probably already taken 200 hours of CE this year already, and so this would be another 300 in the next year. And I definitely don't need the hours. I mean, some people might look at it and say, you may not even need the experience, but I definitely look at it and say, like you're saying, I want to learn from a lot of the best people. I want to learn from multiple people. And, they say your combination of the 5 people you hang out with the most, and so, professionally, we all need mentors. We all need colleagues. We all need people to push us, hold us accountability, to learn from each other. Everybody has different tricks and techniques they can teach each other. And that's kind of what I hope to do in the podcast, is pull the top 2 or 3, 4, tangible items that are take-home lists that you can integrate in your practice. And if everybody shares that with everybody, everybody's, the rising boat, the rising tide, brings all boats up. And I think, with implant dentistry, with the general practice, that's kind of what I focus on. I'm a general dentist. Sometimes it's hard to get that anywhere else, unless it's from other general dentists or other people that are willing to share, because there still exists somewhat this, specialist GP barrier conflict. And so I'm trying to kick through those barriers for other GPs like myself that want to learn, trying to figure out where to go, who to learn from, and and where the truth and real information is coming from. Because I think, you just can't go to a weekend course from an implant manufacturer and think, okay, I've learned all there is to learn. That's just, that ought to just be the first step, not your last step.
Yeah. And hopefully, I look at that. Matter of fact, we just talked about it on the last podcast is, I'm not anti-manufacturer weekend warrior courses because what so many of those courses do is inspire, they do inspire that person. At some point they look like, hey, this might be something I can do. Hopefully, in the course of that the dentist will be like, hey, what I need to do next is I need to, do it right. And oftentimes, I just feel like a continuum type course that teaches you, about risk management and complications and everything in between. It's not just about, drilling a hole and buying some implants. So, but you're on the grade. I love your Facebook group, both of you guys. Truthfully, I look at both you guys' Facebook groups every day. I'd have one. I should probably have one just titled Fireball or something, Fireball Dentist or something. Yeah.
Yeah.
Are you headed to the meeting in San Diego?
I'm not sure if I am. I know, starting the Maxi course this month, September, I'm in Las Vegas one weekend every month. So I'm going to try to do that. I just moved my practice and just expanded and did some things there. My wife's pregnant with her third child. And, it's just, we'll kind of see how this fall goes. I'd love to go. I asked her the other day, I said, hey, hon, you want to take a trip to San Diego? She goes, no. And so I was like, okay, well, there goes that approach. So, I can usually entice her with a vacation, but now she'll be 8 months pregnant, and we got the other two kids, and so I'd love to go. I think I'm going to try to go. I'm not going to don't hold me to the fire. If I don't make this one, I'll definitely make the next big one, because it's you can only do so much. You got to be in the office paying bills. You got to be home with your kids.
You got a lot going on.
But you definitely got to carve out time to. Challenge yourself. I've got a lot of things I'm working on. The Facebook group's a good thing because I just try to post what I'm doing in my office, and it's just real dentistry, and so people like you guys can look at it and say, hey, why don't you do it this way or that way, or have you thought of that, or hey, maybe you did it right, and you guys see something that you like, and most of the times it's good conversation where we all learn. I'm trying to work on some other things. I'm kind of got some ideas sparked in my mind. I may want to try to do some research here, or maybe get a clinical paper written, and obviously maybe some poster presentations for the academy and all of that. So it's implant dentistry's got a lot going right now, and I think we need to be the ambassadors for that. And I'd like to be the next generation along here in the next 10 or 15 years when some of the bigger guys step down. Hopefully, I can keep the charge with bringing it up to the general practice in a way that is memorable. Because I don't like the the idea that like you talked about, people go to these weekend courses and they think hey, I've got it down and I can just go in it and do whatever. I love the continual process of learning. I want to keep diving deeper with what I can what I can deliver with my practice, and the AAID is a great way to do that. It
is, and Danny and I, met through continuing education. We were both at the Coy Center out in Seattle. You talk about all those hours. I look back and it's like, it's the same thing for those that really want to strive to be better. 200-300 hours a year, a lot of time away from home, but dentistry is our life. Implant dentistry, is our passion, and you want to go see somebody that is excited about it and wants to go to work every day and wants to learn more. And you're definitely one of those guys. So, the new office doing good?
Yeah, it really is. We my office was it was interesting. I was working with my father for a number of years, and then I bought a little tiny practice on the other side of town, and then kind of grew it up and then moved it. And so it was kind of part de novo, but part move. But I expanded. I got some better location, really upped my marketing, and so business is growing rapidly the way that I wanted it to. So things are working out well, which is good. Kind of refreshing, when you take out those big loans and hedge your bets that things are going to work out. And so far they have. Now it's just looking at hiring more staff, training, thinking about associate, maybe thinking about, how to get to more and more implant dentistry and less, just onesie twosie fillings. But I am a general dentist office. I want to stay a general dental office. I don't ever want to be, I don't ever want to consider myself a place that, everyone can't go. I mean, I want to be the office that, I can see you from, 5 to 95. I want to treat everybody, but I love implant dentistry, so I'd rather be doing most of my time doing that.
Find someone else to work on the real teeth with you and have them join your practice.
Yeah, so that's what I'm looking at now. I'm actually in the process of interviewing for an associate and working out some issues with that. And yeah, things are going well. It's dentistry is ever changing, and implant dentistry is too. So you've got to always kind of evolve with the times and continue to keep one eye on the business and one eye on the clinic and hope you're doing both right.
Well, I am, like I said, I am going to make it out to KC hopefully this year. I got so damn many friends out there, in KC. I need to go out and visit and run into a bunch of people. So I need to check out your new dig, man.
Well, we'd be love to have you. We've got the Chiefs this fall if you make it. If not, we'll figure something else. So we got the Top Golf. We've got, we got lots to do. I know I haven't made it to your practice. I went through your implant pathway. I need to finish my last course of that. I think in January I'm going to try to sign up for that. And then, Danny, I was going to try to make it to one of your courses here sometime within the next year. I know you've got a lot of interesting courses coming up with some of your 3D technology and some of your sinus and bone grafting and all that. I'm actually really curious about that because that's kind of my next step is more of this advanced bone grafting. That's my next journey and with my implants is creating more bone, creating more opportunities. That's kind of my next goal for 2018 for me. So I definitely need to come down and see what you're shaking up down there.
Cool, man. Love to have you. And soft tissue, man. I think it's imperative.
Oh yes.
Once you get the hand down on singles and even multiples and full arches is to get your hands really good at doing big augmentations with either alloderm or not even using soft tissue and trying to do some non-surgical techniques where you can enhance the soft tissue. Kind of some things that I've showed on that Facebook group, Black and White Implants. If you guys check out his Facebook group, it's 1,500 members, man. That's incredible. You guys have grown so fast. It's Dental Implant Practices and Philip Gordman. You can Facebook group any one of those two. And you post pretty regularly, man. You post on a regular basis. You've had a huge following very fast. So kudos to you. That's incredible. Yeah,
I try to post regularly. Most of it's just whatever I'm doing in that day in the office. It's not, like a strategic plan I have with, I'm going to post this or post that. So that's why, it can be totally random. It's, one day it's impressions for this, or another day it's a delivery of that. Or some days it's, I just got a new toy and trying to see what other people are doing with it. Because, everybody uses it. It's even interesting. Some people pick up the same tool and instrument and use it differently, so it's not only, what are the instruments people are using and what are the techniques, it's how are you using it? It's not just, well, are you doing a sinus lift anymore? It's okay. Well, what type of sinus lift? I mean, there's 5 or 6 different ways to do a sinus lift now. There's 4 or 5 different ways to do a ridge augmentation now. There's so many ways to do a tissue graft now. So it's the subsets have subsets now. So that's where these advanced classes like the ones you're talking about, soft tissue. I mean, that's the more implants you place, the more you realize how important bone, but even more soft tissue is. And I love some of these people that are really just masters with the soft tissue, because that is a delicate art. And that's definitely on my next to do, is to get better at that art form. I feel like I've got the bone down and the screws down. Okay, now let's make more bone. And let's get, let's paint the canvas better with that tissue, because that's kind of like your fail safe. If the tissue's not right, the bone's not going to be good. If the bone's not there, the implant's going to fail, and then the whole house starts coming down. So I, definitely respect that. But yeah, with the Facebook group, I just try to post up there what I'm doing, and it's just a collection of things that come across my plate. Some of it's people come into my office with a problem and how do I fix it, and some of it's, hey, here's what I did, and what do you guys think about that? So just trying to keep it real. We all have good days and bad days. So you just kind of throw them up there and make the best of it.
I think that's a great attitude to have, my friends. Well, I for one can't Can't wait for you to work through the credentialing process. Be there to watch, get your associate fellow, and continue on that path. Say hi to John for us as you start the Maxi course, because John's give his heart and soul to the AAID and to helping other people get better at implant dentistry, and he's one of the best out there. So you're gonna get a good education there. So, man, thanks so much for joining us here on the AAID podcast. Those out there want to follow Philip Gordon, check him out on his Facebook group. And man, we wish you the best of luck, my friend.
Hey, guys, I appreciate it. Look forward to seeing you soon, and take care as always.